When generally we say redness of eye, we mean the white part of the eye that we see from the outside becomes red. So in general terms, redness of eye is redness of the white portion of the eye. If we consider the structure of the eye from anterior to the posterior, any structure like conjunctiva, inflammation of the conjunctiva, like conjunctivitis can cause redness of eye, episcleritis can cause redness of eye, scleritis can cause redness of eye, as well as acute congestive glaucoma can cause redness of eye. All these diseases may present as a primary symptom of redness of eye. Generally, redness of eye is not worrisome if attention is given on time. Occasionally, or we might neglect the symptom and treat with over-the-counter drugs and may so quack doctors who will advise wrong medicines. And in such cases, the disease may become advanced, and when they present to us as ophthalmologists, then it becomes difficult for us to manage the case. Otherwise, mostly it is not worrisome, and generally it cures by 7 to 10 days, provided it is very innocuous and very benign. Someone having a red eye should see a doctor immediately, and especially should see an ophthalmologist and not go to the drug shop and get some over-the-counter medications. Always an ophthalmologist should see it, because be it corneal ulcer, be it conjunctivitis, they are of various types and various symptoms and having various signs. So, which may be missed by a quack or someone else, maybe the drug shop owner. So, they must see a ophthalmologist who will diagnose it, whether it's a conjunctivitis or a corneal ulcer or an acute congestive glaucoma. Even if it is a conjunctivitis or a corneal ulcer, it may be of various types, maybe bacterial, maybe viral, or maybe acanthamoebal. Various organisms are responsible. It may be fungal. So always redness of eye should not be neglected at any cost, and the patient should see the doctor at the very outset. Redness of eye can be a harbinger of a very serious disease, like when we talk about retinoblastoma, it is a grave malignancy of the eye. A retinoblastoma case may present to us as redness of eye. So just because it's redness of eye, it's a very common disease, it should not be neglected. We should keep in mind that some serious illness may be there inside the eye, which are being masked by a simple symptom. The treatment of redness of eye depends on the cause. First, we need to diagnose the disease, the cause due to which the etiology of the disease, due to which the redness of eye is happening as a symptom. When it is a simple conjunctivitis, it may be treated by antibiotics, and generally the patient recovers by 7 to 10 days. But when it is a uveitis, the patient may have recurrent symptoms, recurrent attacks, and especially when associated with other systemic symptoms like joint pain or maybe a psoriatic rash, the symptom of redness of eye may recur maybe after few months and relapse again. So in such cases, it takes time, and the management is in the form of topical steroids. And again, when we are talking about antifungal or antibacterial, topical drugs are given. And then again, when we are talking about acute congestive glaucoma, we often need to admit the patient to lower the IOP and inject certain drugs and give topical drugs so as to lower the IOP and prevent further such attacks in the other eye or maybe in the same eye. Mostly conjunctivitis recovers by maybe 7 to 10 days, but it may have certain sequelae. Like a viral conjunctivitis may recover within 5 days or 7 days, but sequelae to a viral conjunctivitis may be certain SPKs. These are like spots in the cornea, due to which the vision may be hampered. It is due to this reason that I reiterate that ophthalmologist should see the eye, because when a conjunctivitis is happening, and maybe the quack doesn't know whether it's a bacterial or a uh, viral conjunctivitis, it may be mistreated, or maybe some over-the-counter drug has been applied. So by the time the patient comes, maybe the conjunctivitis has recovered, but it sequelae still remain, and it takes a long time. Then again, it takes a long time for the corneal opacities to go away. So timely visit to an ophthalmologist is essential. For the other diseases like corneal ulcers, takes quite a lot of time, maybe 1 month or 1.5 months to recover if properly the drugs are applied. Then acute conjunctive glaucoma, once the IOP is lowered, symptomatically the patients feel better, but the chances of further attacks must be stopped, and certain procedures like laser iridectomy must be done so that the chances of recurrence in the same eye or the other eye may be prevented. And for uveitis, regular follow-up is required once the inflammation has subsided, maybe on low dose of steroid or maybe on certain biologicals. Then the patient must come for regular follow-up so that the inflammation does not recur again. Prevention of redness of eye is generally per se not very feasible or possible, but we must take care of certain things so that the chances of recurrence reduce. Like when we talk about glaucoma or uveitis, regular application of drops, compliance to all the medications that the doctor has given is very, very essential so as to prevent the recurrence or the relapse of the disease. And when we talk about conjunctivitis, maybe it may be seasonal conjunctivitis or perennial conjunctivitis like allergic form. So in certain cases, we ask the patients to keep away from certain allergens like pollens or dust. In such cases, chances of it may not be completely preventable, but the chances of recurrence or chances of the disease happening again reduces by a certain amount.